Since the last update, multiple indicators show that Canada is past the peak of the Omicron wave, though infection rates remain elevated and hospitals are heavily strained. In the presence of overall high vaccination rates, health authorities are closely monitoring improvements of these epidemiological indicators in order to guide the stepwise easing of measures. For the immediate future, key preventive measures remain important for relieving the accumulated pressure on hospitals. Some measures will also be important for protecting vulnerable populations and maintaining readiness for a possible resurgence. This includes reducing vaccination coverage gaps and encouraging the use of personal protective practices, such as avoiding crowding, opting for well-ventilated spaces, and wearing masks as appropriate. Though we are hopeful we are approaching a period of reduced transmission, allowing Canadians a chance to regain a sense of normalcy, we know that SARS-CoV-2 virus is not going away. This updated longer range forecast showing estimated daily cases on the left and daily hospital admissions on the right illustrates how the Omicron wave could evolve in the coming weeks, with many jurisdictions easing public health measures. Note, due to changes in data availability, there is significant uncertainty in these forecasts. The three scenarios shown in each figure show that while Omicron activity has likely peaked, easing of public health measures could still lead to resurgence. The blue line trajectory show that with a moderate effect of easing public health measures, we could expect a limited resurgence of daily cases with potential for a more modest resurgence in daily hospital admissions towards the spring. The red line trajectory shows that with a more substantial effect of easing measures, we could expect a larger resurgence of daily Omicron cases, potentially exceeding prior peaks. But similarly, the peak of daily hospital admissions could be much lower. While resurgence of cases is not unexpected, given the characteristics of the Omicron variant, the good news is that current levels of immunity in the Canadian population are expected to reduce the impact of the Omicron infections going forward. In particular, with an increasing proportion of breakthrough infections in people with some prior immunity from vaccination and/or infection, it is expected that a smaller proportion will require hospital admission, such that the impact on our healthcare system could be less severe, even with a large number of cases.